Today I will talk on irreparable rotator cuff tears. Rotator cuff disease is a common condition that increases in prevalence with the age. The natural history of rotator cuff tears includes tear enlargement, fatty infiltration of the muscles, and degenerative changes in the glenohumeral joint. The clinical implications of these changes range from no symptoms to severe shoulder dysfunction and pseudo-paralysis. Most rotator cuff tears are repairable and surgery is the preferred treatment for those tears. For irreparable tears, treatments range in complexity from simple joint debridement to reverse shoulder replacement. We can divide treatment options into joint preserving options and joint sacrificing options. In joint preserving treatments are often preferred in younger patients or in those with a preserved overall shoulder motion. These options include subacromial decompression, tuberoplasty, and biceps tenotomy or tenodesis, all of which have been shown to provide clinical improvements. When a portion of the rotator cuff is repairable, a partial arthroscopic repair is more beneficial than simple debridement. Arthroscopic partial repair may include partial repair to the greater tuberosity or a margin convergence, where the posterior rotator cuff is repaired to the anterior rotator cuff. There was a study in JBS 1995 on subacromial decompression for irreparable rotator cuff tears. With proper rehabilitation, proper decompression of the subacromial space, anterior acromioplasty and debridement of the massive tears of the rotator cuff can lead to relief of pain and the restoration of the shoulder function. You can do only decompression if there is a stiffness and pain. Tuberoplasty is another surgical option. It is a creation of an acromyohumeral articulation for a massive irreparable cuff tears. There was a study in Shoulder and Elbow Surgery Journal 2002. According to their study, 95% of the patients had satisfactory results and pain relief was most dramatic and it was complete pain-free in 68% of the patients. Biceps tenotomy. Both arthroscopic and open biceps tenodesis or tenotomy can effectively treat severe pain or dysfunction caused by irreparable rotator cuff tear associated with the biceps lesion. Arthroscopic partial repair. There was a study in Journal of Arthroscopy 2012. Arthroscopic partial repair and margin convergence showed satisfactory short-term outcomes in irreparable large to massive rotator cuff tears. Even in a large to massive tear that appears irreparable, attempting to repair it as much as possible to possibly convert into a functional rotator cuff tear by recreating a balanced forced couple can be helpful. Latissimus dorsi tendon transfer. Compared data and frequency weighted means demonstrated improvement in shoulder function, range of motion, strength, pain relief after latissimus dorsi tendon transfer for irreparable rotator cuff tears. Patients and physicians should not expect an outcome of a normal function or a complete pain relief. However, this technique involves taking a muscle that is normally an adductor and an internal rotator of the shoulder and transferring it to replace an abductor and external rotators. Not all patients are able to adequately control the muscle in that construct. Outcome of a lower trapezius transfer to reconstruct a massive rotator cuff tears. Lower trapezius transfer keeps the transferred muscle in a phase and better approximates the pull of the infraspinatus. Transfer of the lower trapezius prolonged with Achilles tendon allograft to reconstruct a massive irreparable posterior superior rotator cuff tear may lead to good outcome in most patients, specifically for those who have a preoperative flexion of more than 60 degrees. Pectoralis major transfer for the treatment. When the subscapularis is irreparably torn, pectoralis major transfer has been reported to provide pain relief and functional improvement. Arthroscopic superior capsule reconstruction can eliminate pseudoparalysis in patients with irreparable rotator cuff tears. Superior capsular reconstruction has gained popularity recently based on the work of Dr. Mallinath. Dr. Mallinatha's procedure uses an autograft tensor fascial lata folded to 9 mm thick, while American technique uses 3 mm to 5 mm thick acellular dermal allograft. Reported results of this procedure using both graft types have been mixed. Reverse shoulder arthroplasty. Shoulder arthroplasty is another option to treat irreparable rotator cuff tears. When shoulder motion and strength are present, but glenohumeral joint shows a degenerative changes, hemiarthroplasty may be an acceptable option. However, in the majority of patients, reverse shoulder replacement delivers the most predictable outcomes. Early complication rates were high with the reverse shoulder replacement in these patients, but complications have decreased substantially in more recent studies.